Okay, most appropriate initial management. Okay, 18-year-old woman, no past medical history, sudden right-sided chest pain, shortness of breath. Blood pressure is normal. Decreased restaurants are noted on the right side. No tracheal deviation. Right-sided pneumothorax with lung collapse. So what's the most appropriate? So, I mean, you have to decompress it. The question is it going to be perform a needle decompression or a chest tube with thoracostomy?
Okay, so I would say that this question is, I would say slightly unfair, right? But I did sprinkle some of these step two questions on there.
Yeah, they're
This is,
good.
yeah, these are more a little bit more clinical. So
Mhm.
always start with, remember, kind of working your way through on a clinical standpoint, right? What's your diagnosis here?
The pneumothorax,
Okay, good. Okay, so we got the right
right-sided
pneumothorax.
thorax.
Now, what do you want to do for the pneumothorax?
Uh, well, then it's just, I mean, you have to relieve the pressure so that the lung can reinflate. Like
Okay.
supplemental O2 is not going to help because the lung can't reinflate against the pressure. Um, I don't think it's bacterial in nature, so I don't think antibiotics would help. I think the first course would be to relieve the pressure.
Okay.
And then same with the nebulizer bronchodilators. Um, it's not that it's vasoconstrictive. It's just the lung is collapsed due to pressure. So I'm not sure between the needle decompression and the chest tube. I would
Okay.
guess probably needle decompression. Chest tube sounds more like if it's got like some kind of exudate around there. You need to drain
Mhm.
it, but I'm not entirely sure.
So yeah, this is a trick question. This is why, like I said, these are unfair in a sense. I like the train of thought that you're thinking, right? Needle decompression is good, but always when you have like in an emergent setting, right? They always ask you what's the first thing. Yeah, you're gonna turn up the O2 just to help you breathe, right? It's not gonna fix your problem. You get what I'm saying, but it's gonna help you
Mhm.
oxygenate in the short time, and
Okay.
then right then progressing kind of to something to relieve the actual problem, which is either a needle decompression or a chest tube thoracotomy. So one or the other is fine.
What would be the difference between those two? Because I'm not entirely familiar with either of them.
Yeah, so needle decompression is literally you take a needle, you push it in, and air comes out, correct?
Mhm.
A chest tube thoracotomy or thoracostomy or chest tube in general is you're placing in the chest tube where that pocket is, right? And continuously, like, depending on how big kind of your pneumothorax is, right? Because if you do a needle decompression, right, then how do I say this? It could be it's a temporary thing. You know what I'm trying to say? You can't leave a needle sticking out from somebody. You get what I'm saying? So
Mhm.
once you take that needle out, there's a possibility that it reforms the pneumothorax. So something that you can leave in a little bit longer is a chest tube that you can kind of keep there until the lung reinflates and kind of scars, and you're like, okay, now I can take this out without it reforming. Does that make sense?
Okay, that makes
Yeah.
sense.
So those are kind of your difference, right? For large pneumothoraxes, right?
Cool.